Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me is
Maddie Norton.
Maddie. Happy November.
Happy November.
And that means it's time for
Our
our
favorite
favorite
time.
season.
Yep. Open season.
It's open. Yeah. Open season. It hasn't started just yet. We're
Right.
This episode should be reaching people on November 3rd.
Mhm.
At least the initial availability, and open season is still a week away.
Yes. Still a week
Uh,
away, but we are super excited for it.
And I just want to note before we get into open season, before we get too excited, we're recording this on October 31st and anticipating posting this in just a few days. And as we're doing that, we're still in a shutdown for the federal
Yes.
government. And I just want to acknowledge that things are tough for a lot of our members, whether or not they're working or furloughed. Most of them, the vast majority, are not receiving a paycheck right now. So I want to encourage people, please, we are still here for you. If you've got claims sitting around that need to be submitted, send them in to us. We'll get them paid as quickly as possible, get some money back to you. This is a great time to take advantage of some wellness programs, take advantage of some mental health programs we have to help you through whatever you may be facing. You can find all that information on our website at afspa.org. And with any luck, this will be over soon, and things back to some semblance of normal. And we're going to try to keep things as normal as possible today and throughout November by keeping our focus on open season.
Yes.
And Manny, we got a number of ways we're doing that.
We do. We have multiple podcasts coming out, just like this one. Be on the lookout for some other podcasts this month that are diving a little bit deeper into the benefit changes that we're making. So if you have questions after this podcast, definitely either wait for our new podcast episodes to come out, or you can join ASPA Live at the end of the month. We're doing it a week early to avoid Thanksgiving. So it's going to be November 20th at 11 a.m. Eastern Time, still on a Thursday, still 11 a.m. So definitely,
Still on YouTube, LinkedIn, and
yep,
Facebook. Yep.
yep, you can go there, and you can submit your questions early using a form that will show up on our Facebook or show up in your email inboxes, or you can submit a question live. So definitely be on the lookout for that. That'll be a longer AFSPA Live episode just because we want to make sure we answer all questions that we can about open season. So be on the lookout for that. And then if you are wanting a more deep dive into open season and what our plan has and the benefits and things like that, then definitely you need to sign up for a webinar with Kyle. Kyle will be doing two types of webinars this open season, one where it is a pre-recorded presentation all about our plan, and then he will come on to do a live Q&A at the end. And then we have a live Q&A webinar, which is just Kyle answering all of your questions. And you can sign up for those at aspa.org/events. And they are free. Anyone can join them. You do not have to be a member of FSBP. If you're looking at switching, these are the perfect type of webinars to go to. And each of them are labeled which kind they are, if it's either presentation and live Q&A or just live Q&A. So definitely make sure you're signing up for the right one. And even better, they're at all times of the day. Kyle has made sure that he is flexible for members overseas, or if you're at work and can't watch and you want to
That's
still want
right.
to attend one either before work, after work, we have them at 5 a.m., 10 p.m., noon, whenever. So definitely check those out. And today we're talking about open season.
That's
So
right. That's right. So we're going to be really focused on this throughout. I'll also mention some of our colleagues are going to be taking part in the
yes,
virtual benefits fair. So if that's something that interests you, we've got a virtual booth that Maddie and her colleagues have set up. Lots of information there. A welcome video from me
Yep.
that took a long time to record, so please go and watch it, enjoy it.
Yep.
And if it gets tongue-tied, that's on me, not anybody's editing skills. And also a lot of information, but we also have some live chat days in there. So we'll
Yep.
have folks answering questions there, and we're planning some of those live Q&As that Maddie mentioned to follow
Yes.
up on those virtual chat days. So join us for any, all, whatever works for you. But we're glad you joined us today because this is our first preview of what's ahead.
Absolutely. And are you ready to get started?
Yes, and in fact, today it's just us, right?
It is. No
All
guests
right.
today, just us. All right. So, if you've been wondering when open season is, when is it, Kyle?
It starts, as we noted, on November 10th,
Mm-hmm.
and it lasts through December 8th.
Yes. And what programs are part of open season?
Sure. Same as always, it's your health insurance through the Federal Employee Health Benefits Program. Also for the Postal Service Health Benefits Program, although we're not going to provide much information about Postal Service here. But also for anybody who's eligible for the Federal Employee Dental and Vision Insurance Program, you can make changes there. And also for the Flexible Spending Accounts Program, the FSA Feds.
Yes. And if people like what they have, they want to continue it next year, do they need to do anything?
They absolutely do not. So with FEHB, you like your plan, you want the same thing, it's all going to remain the same. You take no action. Same thing with FedVIP. If you like your plan, don't do anything. You'll have the same thing next year. FSA Feds, though, is the exception. That program you have to re-enroll in every year. And we're not going to talk a lot about it here, but check us out in the webinars. They've increased the maximums for that program, both for healthcare and for the dependent care in
Nice.
2026. The dependent care, this is the first time it's gone up in at least 15 years, I think.
Wow.
So check that out. Great information at fsafeds.com.
Yes. And if we're throwing a lot of links at you today, don't make sure to look in our show notes,
Definitely.
and we'll have all the links there so that you're not having to scribble down a link real quick. But I know people are wondering, just like many of us are, about what our premiums are going to be next year.
Yeah, no, that's everybody's first stop when
Yep.
they're shopping for plans. And I don't blame anybody. That is mine when we're looking at our
Yeah.
options for our our staff plan.
Hmm.
But I will just say, just generally for the FEHB program, the average increase there, the for the enrollees share is going up 12.3%. Now, obviously, it's an average. Some are going up more, some are going up less. I'm proud to say that Foreign Service Benefit Plan is one of those that is going up less than the average. Um,
Woo.
our self-only and family premiums are going up about 7.5%. And the self plus one is going up only 2.5%. And some of that has to do with how the government calculates the contribution. But last year, those who might remember, self plus one went up more than self only and family. So this is sort of balancing things out. But the important thing to remember is that self plus one still costs more than family, right?
Right.
And there's no reason that if you're just a two-party family, you and a spouse, you and a child, have to be enrolled in self plus one. You can enroll in family, and that's going to result in more than $250 in savings over the course of the year.
Right. And who doesn't want $250 in their
Right.
pockets?
Right. Especially with premiums going up,
Right.
especially with everything else we're considering, and save the money, make the
Save,
change.
yes, absolutely. And then, focusing on specifically the Foreign Service Benefit Plan, what kind of changes can members expect next year?
Sure. So let's start with one place where we're expanding coverage, and that's in infertility services. So we've slowly over the last 3 years expanded our coverage for infertility, whether people are getting testing or if they're engaging in artificial insemination like IUI, or if their situation means that they're taking the step to look at in vitro and similar services, we've expanded it. But one thing we haven't covered is storage costs.
Right.
Uh, that changes in 2026. So we will be providing coverage for, and I'm quoting here, cryopreservation and storage costs for all members who experience infertility. And that includes members who are experiencing infertility as what's classified as iatrogenic. So if it's the result of a treatment for, such as chemotherapy or something like
Mm,
that, or for other reasons. And there's no annual dollar limit or time restriction on egg or sperm storage as long as the member stays enrolled in FSBP.
Gotcha. And this is not a question that we have planned to ask, but
Uh-oh.
are people eligible if they are just wanting to, they're not ready to have children at this time, but they want to eventually? Is that something that they
Sure,
could?
that's a good question. So if we're talking about what is sometimes referred to as banking,
Yeah, okay, yeah.
so that is not covered right
Okay,
now. So this is only when somebody has a diagnosis of infertility, and
gotcha.
it also has to be that they've gone through a prior approval process
Hmm.
with the plan, working with our care managers, and that's anywhere in the world. So whether in the
Gotcha.
United States or overseas, we're going to require some information from their doctor and from the member showing that yes, they do have documented infertility, there's a medical reason, and so forth. It's not just planning ahead.
Right,
That is not covered. I know there are some commercial employers out there who provide coverage for that and so forth. Is not part of the coverage under FSBP. But I really appreciate that question and also the opportunity to remind people this will require prior approval
right.
as part of the um, uh, art services.
Yes. Yeah. And I know we've had lots of members ask about egg storage and
Yeah.
everything like that. So like that's super great that we're offering that.
And I will say if people have gone through treatment previously, they maybe have storage, please contact the care manager you've worked with to talk about this expansion of benefits in 2026.
Gotcha. All right. I know we have a new change with retail and walk-in clinics. So
Yeah.
what's changing there?
So these are the clinics that like a CVS Minute Clinic or the Little Clinic that are typically attached to maybe a pharmacy store or even in a grocery store.
Right.
Um, and in all honesty, over the last 2.5, 3 years, we've seen a huge decrease in the number of visits. And I think this is really because we saw a huge increase during COVID. A lot of
Right.
people were going there for tests, for treatment, access to Paxlovid when that became available, and so forth. Um, and so we've seen a similar decrease, but we've also looked at the services that people are accessing in these walk-in clinics. And most of the time, people seem to be going for primary care
Right.
reasons.
Hmm.
And so we're changing our benefit to reflect that. So starting on January 1st, 2026, visits to retail clinics will be covered like other outpatient visits. So subject to the calendar year deductible. Um, and with the plan paying 90% for in-network locations and 70% of the plan allowance if you go to an out-of-network location. And a lot of people, we look at access to these types of clinics at least once a year, usually twice a year at a minimum, to see that over around 80% of our members in the United States and more in urban and suburban areas have access to an in-network
Right.
provider. So I encourage you, whenever possible, use an in-network provider, even when it comes to these retail clinics.
Absolutely. Um, all right. I know I've been hearing a lot about out-of-pocket maximums.
Yeah.
So how is that changing?
Sure. So we have not changed the out-of-pocket catastrophic maximum, to use the full term as it appears in the
Right.
brochure, in over a decade. And so we've been re-examining things, and for 2026, we're going up a bit. So for self only, the out-of-pocket maximum will now be $6,000 for in-network and $8,000 for out-of-network. And if you have Self Plus One or family enrollment, the max will be $8,000 in network and $10,000 out of network. And I will note that if you're in a family enrollment, if one member of the family hits that individual maximum, we'll start paying 100% benefits for that family member. Other family members can combine their claims to meet up to the family maximum, and we'll start paying.
Gotcha.
Also want to note that these are cumulative, so you're not meeting 6,000 in network and then an additional $8,000 out of network. It's
Right.
just the most you'll pay is 8,000 for an individual, or 10,000, and essentially these increases are going up about $1,000 in each category.
Gotcha. All right. Good to know. I'm glad that you mentioned how much they're increasing just from the past, because
Right, it's not
that's
a
what
huge
people want to
increase,
know.
and it's also you know well below stated maximums. That's not something we've ever held ourselves to. We're just trying to look at ways to help control costs for everybody over the long
Right.
run.
Gotcha. All right. Another area where costs are going up is prescription drug cost share.
Yeah.
Can you lay out the details about that?
Yeah, and I think some of our members have already picked up on some of these changes. We were just discussing some things we've seen on Reddit and other
Yep.
places online. So I'm glad members are tuned into this. But this is another area where we haven't had changes in a decade. So before I get into the specifics, I want to stress that the changes are only for our FSBP high option plan. This is the plan that most
Yes.
people have. But if you're enrolled in the Medicare Advantage plan, to use the official name, the FSBP Aetna Medicare Advantage plan, or the FSBP Express Scripts Medicare Prescription Drug Plan, or the PDP, which has over 6,000 people enrolled in that one, prescription cost shares are not changing. Those are staying the same. So there might be some opportunities for savings. Stay tuned for future episodes, I think.
Yep.
Um, but all right, so let's talk about the high option. We are keeping
Yes.
the 6-tier structure. So generic, preferred brand name, and non-preferred brand name, and then the same structure with specialty drugs. When it comes to non-specialty drugs, generic drugs are going up a bit. $12. They'll now cost $12 for up to a 30-day supply. So if you're going and getting an antibiotic for strep throat, ear infection, something like that, get a 10-day supply that you'll be paying $12. And they're going up to $20 for up to a 90-day supply. So if you're on a maintenance medication, that's a generic cholesterol drug, high blood pressure drug, something like that, you're not going to pay more than $20. And I want to stress that not pay more than. That's the case across all categories. If the actual cost of the drug is less than the copay listed here, you're going to pay the lesser amount.
Right.
And that's always been the case. I just want to stress that's not changing either.
Right.
All right, so let's move into tier two. So those are our non-specialty preferred brand name drugs. And these include, and this comes up a lot in discussions, these include the ever and growing popular GLP-1 drugs.
Right.
And we'll talk more about those in just a minute. But a 30-day supply for a preferred brand name non-specialty drug will now be 35% of the cost. The member will pay 35% of the cost up to a maximum of $150. And a 90-day supply of these drugs will also be $35, 35% of the cost, excuse me, up to a maximum of $300. So that is a
Right.
change. But our goal is still to keep things affordable.
Right.
If you're taking a non-preferred brand name drug, a 30-day supply will be 45% of the cost, up to a maximum of $300. And if you're looking at a 90-day supply of those drugs, members are responsible for 45%, up to a maximum of $400. The specialty drugs, these are equal sort of between the 30-day and the 90-day coverage. So for tier four, which is generic specialty drugs, and that's whether it's for a short term up to a 30-day supply or the 90-day supply, members are responsible for 35% up to a maximum of $240. And the good news is that's the same benefit for tier five, the brand name specialty drugs, the preferred brand name. The difference, though, is for the non-preferred brand name specialty drugs, those tier six drugs, members will be responsible for 50% of the drug cost up to a maximum of $480. And that's for short term or for 90-day supplies. So same benefit there. And I just want to stress that again, our goal is to keep the prescription drugs affordable and keep our formulary as open as possible to not have to start limiting access to certain drugs to
Right.
control costs, keep things available to members.
Absolutely. And just to reiterate, because I know it's a lot of numbers, it's a lot of
Yes, yes.
insurance can be very confusing. I mean, at least for me. So we're saying when we say like up to a max, like that's the most you'll ever pay for when you're getting that drug. So
Yep,
you're not going to pay more than, say, for tier six, you're not going to pay more than $480
that's
for that
right.
drug. So
That's
just to
right.
keep that in mind. And if you still have some questions, don't worry. We're going to explore the prescription drug cost shares in more detail next week in next week's episode. So tune in for that. And you said we would come back to GLP-1s. So what's happening there?
I did. So, GLP-1s, and I think a lot of people, particularly people who are taking these drugs, know what they are now, know that that's the category. But just in case, I want to say these are drugs like Ozempic and Manjaro that are prescribed for diabetes, or Wegovy and Zepbound that are typically now indicated for weight loss or weight management.
Yep.
And they are incredibly popular. I actually just looked at a statistic and we saw a 77% increase in new users
Wow.
for weight loss drugs just in the first half of 2025.
Wow.
77% of users were not using it in 2024. So very popular. And again, we want to maintain access to this. So, um, but we also want to try to make sure that they're affordable for members and also that,
Right.
the prices of these and other drugs. I don't want to scapegoat these drugs. It's
Mm,
increasing costs for a lot of drugs. Um, that their impact on premiums don't price everybody out of the
right.
plan. So we're trying to
Correct.
control things on both fronts. So we're adding some new management and support programs, and the overarching program is called Encircle RX. So people may see some information about that. And for diabetes prescriptions of GLP-1s, basically the changes are going to take place behind the scenes to ensure that patients receiving Ozempic and Mounjaro actually have a diabetes diagnosis. And most of that
Right.
will not require intervention from members. We've likely already got that information on file as a result of A1C lab tests and
Right.
things like that.
Which is a requirement for most other plans as well. So we're
That's
just
right. That's
catching up.
right.
Yeah.
Absolutely. So and it's already been in place. We're just tightening it up a little bit. Um, but there's a bit more to the Encircle RX program for weight management.
Yes.
Um, there are new criteria for the prior authorization. And this is a step that your prescriber, typically your doctor, has to complete through the plan, usually
Yes.
directly with Express Scripts. So doctors will need to confirm that a member who's being prescribed the drug either has a BMI, body mass index, of 32, or I should note that they had a BMI of 32 or higher when they started taking the drug. If you've been on the drug
Yes.
for some time, you likely lost some weight, and wouldn't meet that. But when you started taking the treatment, that you had a BMI of 32 or higher, and this is a change from what we've had in the past, which was 30 or higher.
Right. So only
Um,
up to of the
Yep.
index. Yeah.
Yep, it's 32 or higher. So
Mm-hmm.
if you had the 30 or 31 when you started, that you're falling out, the coverage won't be there anymore. So there's a bit of disruption there. The other option is that the prescriber will confirm that you either had when you started or currently have a BMI of 27 or higher and two comorbidities. And that's the
Yes.
official term. But what we're talking about here is high cholesterol, high blood pressure. There's a number
Right.
of things. Doctors confirm this. It's a fairly quick process for them to confirm that. Additionally, though, and this is where something new will come on for members, members seeking coverage for GLP-1s for weight management will need to enroll in the Advanced Weight Management Program through Teladoc Health. So a number of members are already using a similar program. This will be stepped up a little bit, but that will be a requirement that members have to engage in starting in 2026.
Gotcha. And I know in 2 weeks we'll talk more about those requirements, but just to ease everyone's minds, can you give us a little preview?
I love a good spoiler.
Yeah.
So yeah, but members, so to begin with, members must be enrolled in the program for their first fill in 2026. If you're already on these drugs, you should be receiving information about that before the end of the year. We've also got information on our website. And I also want to note that your doctor will have to complete a new prior authorization for your first fill, even if it's a refill in 2026. And then throughout the year in 2026, if you want to get a refill of a drug that is indicated for weight management, you must participate in the advanced weight management program. And
Yes.
that means that you've got to weigh in 4 times per month on the smart scale that will be sent to you as part of the program. And you've also got to engage with the program through the app. This is through the Teladoc app, at least 4 times per month by doing things like tracking your food, reading an educational article, or perhaps most effective, engaging with a coach who can talk you through your weight management journey and managing other conditions you might have. So I don't want to go too far. Maddie, you said 2 weeks. I will wait and learn more then, and as will our
Exactly.
listeners.
Exactly. So, yes, more to come on that on November 17th. So, be on the lookout for that. And are there any other changes to the plan?
Yeah, there are a few, but I really want to take a moment to highlight one that is impacting several hundred of our members.
Hmm.
There are mandated changes across all FEHB and Postal Service plans in terms of coverage for gender reassignment surgeries and hormonal drugs for the purpose of sex trait modification. And I'm using that language really for the first time, I think, in at least our podcast,
Right.
quoting the instructions that have come from OPM and also reflecting executive orders that were issued by President Trump throughout 2025. So I just want to note that the FEHB and Postal Service programs are unique in that they are not subject to state level requirements. They're not ERISA plans. They are some of the HMOs, I should say, may have state level requirements, but the FEHB plans, particularly like us,
Right.
we are subject only to regulation from OPM.
Yes.
And OPM is the final arbiter, and they let us know what we can cover in the end, and what can't be covered. So beginning in 2026, this plan, Foreign Service Benefit Plan, and all FEHB and Postal Service health benefits plans will exclude coverage for gender reassignment surgeries and hormonal drugs for the purpose of sex trait modification. There will be limited exceptions allowed. And what I have to say is that the guidance on the exceptions has not been um, written or very clear, and so different plans may interpret this differently.
Yeah.
I will say that typically the exceptions will only be allowed if you remain enrolled in the same plan from 2025 to 2026. But I do want to encourage members who may be affected by these changes, contact us
Yeah.
or contact your plan if you're with a different plan for more information. I also want to say that this is a reversal of a coverage category that has been regularly expanded to include more treatment and greater equity in terms of coverage over the last decade. So I just want to say to members who are losing this coverage, please contact us. We'll talk you through what exceptions are allowed, and do our best to help you with treatment in an ongoing way, as much as we can. And I will note that there is ongoing coverage for mental health treatment related
Yes.
to gender dysphoria and similar diagnoses, but that obviously does not take the place of these other treatments. So please don't hesitate to reach out to us, and we can talk you through what's possible.
Absolutely. And if you are wanting more information, like we said at the top of the show, members should join us for members or non-members, should join us for an open season webinar. There's going to be more than 10 that Kyle's going to be offering throughout November and into December with a couple of different formats, the live Q&A versus the recorded presentation and live Q&A. So you can find all of them already at afspa.org/events. You can register for them. They'll be on Zoom. So definitely register for that so that you know all the details about the plan and can ask your questions. And then, of course, like we've mentioned throughout the show, stay tuned to ASPA Talks to get more details about different plan benefits and changes.
Absolutely. And as Maddie said, check the show notes. We're going to include a
Yes.
number of different links in there, including the open season webpage that Maddie and her colleagues have put together with information on all the changes, including the premiums.
Yep.
And we'll also put a link to the drug pricing tool in there just so you can go check that out with the changes. You can select 2025 or 2026 so you know what you're paying this year,
Nice.
or what you'll be paying next year.
Perfect. All
All right.
right.
I'm going to take us out.
All right. Go
All right.
ahead.
So for more information about all the benefits and programs offered by the Foreign Service Benefit Plan and AFSPA more broadly, please visit afspa.org. This has been AFSPA Talks. It's a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and be sure to subscribe or follow AFSPA Talks on your favorite podcast app to catch our next episode. And also catch videos of us on our YouTube page. Rate and review us, leave us your feedback and comments on Facebook, Instagram, LinkedIn, or in the comments section on YouTube. Search for @AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of ASPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.